Hello and welcome to Health with Patricia, where we have honest conversations about issues affecting your health and well-being. And today I'm at Medifem. My guest is Dr. Joseph Homia. He's a fertility specialist and he's going to help us understand a particular issue affecting women, young women, women in their reproductive age, that is endometriosis. What is painful menses? Is it every painful menstruation or every painful period that is term endometriosis? He's my guest today and he's going to help us understand. Thank you very much, sir.
You're welcome.
Dr. Homia, endometriosis. Is every painful menses that we can say? Because growing up, I also had that.
No, it's not every painful menses that you can attribute to endometriosis.
Okay.
Endometriosis is just one of the causes of painful menses, even though it's the most severe or serious cause of painful menses.
Okay.
But it's not every painful menses that is endometriosis.
Okay.
Endometriosis basically means that the lining of your womb, where you normally shed menses from at the end of every month, the tissue there can be found in other locations.
Okay.
So instead of that tissue being just in the womb, it can be found in your pelvis, it can be found in your upper abdomen, it can be found even in your lungs, and it can even go into the brain.
Wow.
So what happens is that every month, as you are menstruating from the womb, these ectopic tissues or tissues that are at places that they are not supposed to be will also be menstruating. So you'll be producing blood into the abdomen, into the pelvis, into the chest, into the brain. The typical features of endometriosis is very painful menses, very painful sex, infertility, okay? Then some would have pain with defecation, pain with urination. But it's not a simple pain that people normally go through like during their menses. This pain can be so debilitating that, in fact, some have committed suicide from it. Some cannot function. They cannot go to work. And it's not only during your menstrual period. The pain gets worse during your menstrual period, but in between your menses, there's still a baseline pain that is always there. And it's kind of a hidden ailment for a very long time amongst us because we're taught that menses comes with pain.
Yeah.
But that is not true. Endometriosis pain, now endometriosis is becoming big. There's so much on it because it's very debilitating. It can affect your fertility. It can affect your quality of life. It can be depressing, has mental health issues and all that.
What causes it?
The basic thing is that what produces normal menses in your womb can be found outside. That's what we call the endometrial glands.
So like something, is it you're born with it?
Yes, most often you're born with it. Sometimes there are a lot of theories to underline endometriosis. The commonest one is that when every woman menstruates, a bit of it goes back into the pelvic cavity through the tubes. It settles there, and they also start producing their own menstrual flow every month under the hormonal estrogen cycle. So anytime you're menstruating, that is coming out, you're also menstruating inside the body, and the blood that is collecting in the pelvis or in the abdomen, that's not where it's supposed to be. This is altered blood, or let's say dirty blood. So it's like dirty blood in your pelvis. It causes a lot of reactions and a lot of damage to your tubes, your pelvic organs, your intestines and all that. They all get stuck together. Then it gives you a lot of pain. So much pain that some cannot even have sex at all.
So it looks like when you get to your reproductive age, it's time for you to menstruate. Then it's pain throughout.
Yes. Pain throughout. Worsening pain.
So in this case, do you have to rely on painkillers? Even if you have to rely on painkillers, for how long?
Yeah, the severity, it can be mild, where a few paracetamol or NSAIDs or naproxen can take care of it. Then you have the very bad ones where the patient cannot even function at all. In fact, during those periods of the month, she cannot go to work. She cannot do her normal chores at home. To the extent that some can't even have sex at all because sex is so painful that they wouldn't allow their partners to touch them at all. And with that comes also the fertility issues.
Yeah.
Because apart from the sex that they are not having, the blood that is collecting in the pelvis is also distorting the tubes and all that, distorting the ovaries, reducing the egg quality. So fertility also goes down. And this chronic pain is virtually there till menopause.
Hish.
You know, and it's very difficult to manage.
So at this, with this, like, how do you diagnose it and how do you help the person?
Mainly the symptoms, the spironeal pain with sex, very painful menses, most often throughout the month, infertility. If you have these three, we really suspect endometriosis.
Okay.
But the gold standard to diagnose is to do what we call laparoscopy.
Okay.
Where we put a small camera through your navel into the pelvic cavity. Then you see the endometriotic tissues there. You see bleeding
all over.
Then you pick a sample, then the pathologist will tell you these are endometrial tissue. And the endometrial tissue are not supposed to be found in the pelvis. It's supposed to be in the womb. Then it confirms the diagnosis of endometriosis. At that point, treatment can also be effected by burning the endometriotic tissues that are in the pelvis whilst you are doing the laparoscopy. So we kind of burn it, each of it, and it will bring some relief.
Okay.
There are medications too that can be used to suppress it, but you don't treat. You don't. It's not like you recover completely from it.
It doesn't really have a cure. You can
It has
just
to be
manage.
managed. Yes.
I want to know, when it comes to this, at what age can you start, like, maybe managing the symptoms? Aside noticing that maybe the person cannot have sex, like difficulty during intercourse and infertility, maybe like a teenage, reproductive age has started.
Yes.
Can you help them around that age?
Yeah, you can help. You can help them around that age. One of the medications that help with endometriosis is oral contraceptive pills. So that suppresses the pain for a while. So for a teenager, that's what I would recommend. But for an adult who also has fertility wishes, or when all these medications are not working, then you obviously need a laparoscopy. 1, to confirm, 2, to treat. In fact, at some stages in endometriosis, you might have to remove the womb, the ovaries and everything, something we call pelvic exentration. Remove all the organs in the pelvis for her to have a comfortable life. Or you block all the nerve endings into the pelvis. You cut them off so that the nerves cannot pick up pain from the pelvis. That is how serious it can be. The good thing about endometriosis is that when you get pregnant, the symptoms goes down.
Oh.
Yes. While you are pregnant, the symptoms goes down. So you deliver, then it comes back again.
Oh.
Laparoscopy can be done for anybody.
Okay.
If the pain is so bad, affecting her quality of life, schooling and all that, you can do the laparoscopy to burn the endometriotic tissues in the pelvis, and it gives them some relief, and also reduces the damage that is going to cause to the fertility aspect of the lady. So you don't always have to wait till all those fertility issues have arisen. Sometimes you have to intervene to prevent fertility issues.
Okay.
Yes.
So for how long is maybe a woman or a young lady supposed to stay on the contraceptives? Is it till maybe...
So she wants to have a baby.
Okay.
So she wants to have a baby.
So in this case, is it like the medication or the implants or IUD, or what do you do?
The oral one is fine. Implants are also available. IUD might not necessarily take care of that.
Okay, sure. When it comes to endometriosis, what are some of the things that women are supposed to do to manage the situation?
Well, the first thing is knowing the diagnosis.
Okay.
Knowing that is what you're suffering from. Now there are support groups all over. If you go on Facebook, Instagram, there are endometriosis support groups where people share their stories and how they are coping and all that. So we encourage young ladies to take advantage of these groups. Then, of course, you have to learn your own coping mechanisms, hot water bottle and all those things, trying to manage it and all that. But the very severe ones would require surgery. This is minimal access surgery. We can do it in the morning, by evening you're back home.
Okay.
And that helps a lot. Your mental state, you need people to talk to you. Sometimes you even need a psychologist, because the coping can be very difficult. Imagine a young lady in pain, it's affecting the marriage because there's no sex. Anytime the man wants to have sex, she's in so much pain, she wouldn't allow. And obviously, if you're not having sex, no children, it's going to lead to breakup of the marriage and all that. So it's a big condition. It's now coming. I'm happy. I think there's an endometriosis society being formed in Ghana now,
Okay.
and people are giving a lot of input and all that. But the key thing is to be diagnosed.
Okay.
And to be diagnosed, you have to come to the hospital. Ideally, we need a laparoscopy. It's a minor procedure. We'll take the samples, confirm. Then you know that this is what you have, and this is how I'm going to manage it. And this is where, in terms of fertility, in terms of relationship with my partner and all that, so your partner also understands that you're not just being difficult, because for a man, if you refuse too much, you assume you're getting somewhere else.
Okay. I get it.
So he has to understand the condition you are in. Either you're getting somewhere else or you don't like him, and it brings a lot of conflict.
Okay, sure.
But if he also appreciates what you're going through, your medical condition, then of course there's more understanding, and there can be ways where intercourse or intimacy can be achieved without deep penetration. But endometriosis tend not to respond
to painkillers.
Yes. I mean, the mild ones might, but the very severe ones, it doesn't. And there's a lot of pelvic congestion, discomfort and fatigue. Surprisingly, it doesn't only affect the pelvis, it affects your whole well-being, because you don't feel comfortable and all that. And it can actually go into the brain to the extent of giving you seizures.
That's serious.
It could go into your lungs to the extent that
you can't breathe.
Yes. And there are some people, you see that the navel is a bit swollen. Anytime they are menstruating, they get blood coming from the navel. It's all endometriosis. So you need to seek specialist attention, and most often we can help you manage it.
Okay, sure. Doc, your final words.
Well, what I would say is that let's not assume that pelvic or pain during menses is always normal. It's not always normal. There are a lot of conditions, and one of the biggest is endometriosis. If endometriosis is not tackled early, eventually it's going to lead to fertility issues. So if you are having chronic pelvic pain, it's about time you see your physician to examine and evaluate whether this is endometriosis. If it's endometriosis, then we can put you on a path to try to manage your symptoms for you.
Thank you very much, Dr. Homia. So that has been my guest, Dr. Joseph Homia. He is the medical director for Accra Fertility Center. He's also a fertility specialist. And the show has been Health with Patricia. I told you we bring health expert closer to you. So stay informed, stay healthy. And if you haven't subscribed yet, please subscribe to Health with Patricia on all socials and share the videos. Until same time, see you in the next episode.